Wheels, California, and we are so thankful for their partnership. Today's session is going to be focusing on brain health in relation to diet. And our agenda is just going to be focusing on just a quick welcome and introductions, and then moving on into our didactic, and then just some closing and some time for questions if you have any. We do offer CE credits for this session, so we will have a QR code at the end of the session that you can scan, and we will also send it via email, also with evaluation links as well. So if you do want, and this is BRN CE credits that you can submit to your own boards for reciprocity. This is a grant-funded program by the Health Resources Services Administration called Technology Advanced Geriatrics, together advocating and educating and mentoring. This information or content and conclusions are those of the author and should not be construed as the official position or policy of HRSA, HHS, or the U.S. government. So again, if you're just joining us, please put in your name, location, and site. I do see a lot of people from Oakland, some from Orange County, Walnut Creek, Sacramento, Bakersfield. Again, thank you all for joining us. Today's session is focusing on brain health in relation to diet, and we have one of our wonderful geriatricians here from UC Irvine, who practices in our Senior Health Center here in Orange. Her name is Dr. Perera, and Dr. Perera, I'll let you go ahead and get started on our wonderful session today. Before you get started, I just want to let you know, if you do have any questions, feel free to put them in the chat, or you can wait until the end of the series. You are all muted upon entry. So again, we'll wait until the end for questions. Thank you so much. And Dr. Perera, you can take it away.
Thank you, Nika. Hi, everybody. Good afternoon, and welcome to this very interesting discussion about brain health in relation to diet. Next slide. I want to focus on three main objectives today, and that is to recognize the growing burden of dementia, and then to identify strategies to prevent dementia, and then specifically focus on diet, the role of diet in preventing dementia. But firstly, let's identify what dementia is and how we define dementia. Dementia is a clinical syndrome that is it's a group of characteristics and symptoms that's related to cognitive function and your day-to-day function. And it's a syndrome where we see a decline in both these components that's caused by a range of diseases or injuries to the brain. When we talk about cognitive function, there are many components, not just memory. There's language, there's your ability to plan out something, goal-directed function, that what we call executive functioning, complex attention, doing a complicated task that requires multiple skills, navigating yourself in the environment, and also social skills. So in different types of dementia, different components that can be affected more than others. So a decline in cognitive function tells us there's something going on with cognition, but it doesn't really mean that you have dementia. Dementia really means that when these cognitive declines start affecting your daily function, whether it's the basic functions like going to the bathroom, getting dressed, feeding yourself, or a slightly higher level of function that's important for independent living, like managing your finances, cooking something, driving. So we look at all these different types of functions, and then we see how much of them are affected. And if function is affected, we generally define that as a major cognitive disorder or dementia. And if a person remains independent in their daily living and their day-to-day higher levels of function, we call it a mild cognitive impairment. Next slide. So the general range of normal aging to mild cognitive impairment and dementia is, as you can see, dementia is the latest stage, the higher level of severity of the decline. As we age, we could have some difficulty with multitasking. We may not be as good about remembering things, but in general, the memory or whatever you're trying to recall should come to you. But as you move on to mild cognitive impairment and dementia, it gets harder and harder to do that. But keep in mind, though, not everyone who has mild cognitive impairment goes on to develop dementia. Sometimes you stop at mild cognitive impairment. And really, it really depends on, what's causing the underlying disease process, what are your, your lifestyle, what's the support you have, kind of to help prevent or at least reduce the decline in cognitive impairment. Next slide. So as I mentioned before, there are different types of dementia. So what we categorize as neurodegenerative, that means it's a process where there may be a decline in nerve function and changes in your neurons. So in general, it's a natural process that can the decline can happen progressively, and usually presentations like Alzheimer's dementia, Parkinson's, Lewy body dementia fall under neurodegenerative disorders. There are other types like frontotemporal dementia, Huntington disease, progressive supranuclear palsy, not as common as Alzheimer's, but they do fall under the neurodegenerative disorders. And Alzheimer's disease is the most common type of dementia that we talk about. And then there are non-neurodegenerative types of dementia, and the most common one we talk about is and the most common one we see is vascular dementia. But again, that's not the only one. You could have non-neurodegenerative dementia because of increased pressure in the ventricles, we call it, this fluid-filled sections, parts of the brain, or it could be related to chronic trauma or alcohol that could cause dementia presentation. And then we have a mixed type where you could have, for example, Alzheimer's and vascular dementia, where we could see injury to the brain as part of your evaluation, but also the progression of the disease may not necessarily be the typical Alzheimer's dementia we see. So sometimes it's a mixed type. Next slide. So dementia is an important topic because we're seeing more and more people diagnosed with dementia. And part of it is, as a society, we are living longer, and probably our diagnosis of dementia has also improved. But overall, we do see the growing burden of dementia. Every year, about 10 million new cases are diagnosed worldwide. And then by 2030, it's projected worldwide, the number of persons with dementia would be high as 82 million. And by 2050, 152 million. And along with this, of course, there's higher burden of disease on the patient and their family, but also the healthcare cost that is also growing. And in 2015, the global cost was $818 billion US dollars. Next slide. Here in the United States, in 2014, there were 5 million adults over the age of 65 diagnosed with dementia. In the same year, about 200,000 persons younger than the age of 65 was diagnosed with dementia. So in general, dementia is a disease that occurs as we get older, and usually we see a higher incidence after the age of 65. But again, depending on your risk, for example, if you've had trauma to your brain, repeated trauma to your brain, you may have presentations at a younger age. And by 2050, the total number is estimated to increase from 5 million to 14 million. Alzheimer's disease is the sixth leading cause of death in the United States. And just like in the rest of the world, it is affecting our healthcare cost, and there's a growing burden on our society, not only getting diagnosed with dementia, but, taking care of our patients, for the family members and caregivers' stress. Next slide. So this is from the Alzheimer's Society, and they also predict the increasing healthcare cost on taking care of patients with dementia. Next slide. So when we talk about preventing dementia, it's really important to identify what are the risk factors. Next slide. So there are non-modifiable risk factors like age and genetics, which, as we get older, the risk of dementia is higher, and genetics is your genetics. You're born with that. But as you can see, there's a longer list there for modifiable risk factors like injury to the brain, like taking precautions to avoid trauma to the brain, your diet, which we will be talking in more detail at later slides, physical activity, managing chronic diseases like diabetes, hypertension, your cholesterol, looking at medications and really seeing which medications are beneficial and which are harmful for your cognition with long-term use. Alcohol smoking can cause injury to your brain, and social isolation is also recognized as a risk factor. Next slide. The World Health Organization has put out this statement. The World Health Organization states that while age is the strongest known risk factor for cognitive decline, dementia is not a natural or inevitable consequence of aging. So really, I think this statement highlights that, there are non-modifiable risk factors, but really we need to really look into on, how we can prevent dementia and have, healthy aging, look into healthy aging. Next slide. So the WHO has a global action plan because of the growing burden of dementia, and they are focusing on 7 action areas. The first one is to make dementia public health priority, increase awareness, like what we're doing today, and work on reducing risks for dementia, improving diagnosis, treatment, and care, and also support for dementia, along with support for the patients, also support for caregivers, building information systems for dementia, and then also improving research and innovation to take care of our patients with dementia. Today, our focus is on risk reduction. So here's a summary of their recommendations on preventing or reducing risk for dementia. So whenever the World Health Organization felt very when the benefits were way clear than the risks that are involved, the strength of the recommendation was categorized as strong. So it depends on a lot of factors like the research and the data they have, and also the confidence that the benefit of doing something outweighs any other risk. So with regard to physical activity, they recommend strongly that staying physically active helps reduce the risk of cognitive decline in patients who have normal cognition. But for those who have already had some impairment, they have a conditional recommendation. And it's not to say it's not beneficial, it's just that it should be something that should be an individualized decision. So physical activity in general is recommended for all patients for healthy aging. But when it comes specifically to cognitive decline, if you have normal cognition, it's recommended strongly that you stay physically active. Next slide. They also make conditional recommendations for use of alcohol and then cognitive interventions. The quality of evidence to reduce or stop alcohol use that can be harmful for cognition was moderate, but they do encourage to reduce alcohol use. For cognitive interventions, we don't have a lot of data to support this, but again, it can be individualized, kind of doing cognitive training, improving your learning skills. There are some specific programs, some practitioners who offer this. It could be looked into to prevent cognitive decline. Social activity. So we do recognize that social isolation, which we saw especially during the pandemic, as a risk factor for worsening cognitive function. But unfortunately, we don't have enough evidence yet to really support this scientifically. But overall, the World Health Organization do recommend social activity as part of healthy living and healthy aging. Next slide. There were other recommendations to help prevent or reduce the risk of dementia, and that was on having good management of your high blood pressure, your diabetes, your cholesterol, and also managing a healthy weight. So this actually supports the fact that managing your blood pressure, your blood sugar, and your cholesterol does reduce your risk of strokes and thereby vascular injury to the brain. And we talked about vascular dementia, and that is a result of either because of a stroke or prolonged small injury, like ischemic injury to the brain. So it does reduce that risk, but also, having a healthy, blood sugar control, cholesterol also can reduce your risk of oxidative stress. So again, that could be another way that we can reduce risk of developing dementia. Management of depression and using hearing aids. There are no sufficient evidence to support this. There has been no evidence to say it is going to expedite the onset of dementia, but there's no support to say that, using these hearing aids or treating depression will help prevent the onset of dementia. But we understand that it is important for healthy living, so we do support it. Next slide. So I want to spend the next few slides talking about weight management. And this is it's a conditional recommendation for those in midlife who are overweight or obese, that losing weight and maintaining a healthy weight may reduce the risk of cognitive decline and development of dementia. Next slide. And just wanted to mention that, maintaining a healthy weight helps control your blood pressure, diabetes too. So that's another way that, that it can help with your overall health. But in patients who are older, when we talk about losing weight and maintaining a healthy weight, it's important to recognize that older patients, their healthy weight is not the same as for those who are younger. So you may be familiar with the body mass index. It's a calculation between your weight and your height. And in general, for older adults, a healthy body mass index is considered to be between 18.5 and 24.5. So we usually want the BMI to be less than 25. But in our older patients, they've actually recognized that you do need to have a higher body mass index. And a lower body mass index was associated with a higher mortality or morbidity risk. So in general, for our older patients, we consider a healthy body weight to be between 24 to about 30.9 BMI. So again, we don't want our senior patients to lose too much weight, but maintaining a healthy weight is important. Next slide. When it comes to weight loss, important to do the weight loss program methodically. And it's always good to consult a dietitian, and then also aim for a slower weight loss rather than going on a, fasting for days to days, and then kind of rapidly losing weight, because it is discussed that when you lose your weight slowly, you can maintain that weight loss longer, and also because it's a much more healthier way to lose weight. We have to be cautious of fad diets. At certain times, certain weight loss diet programs becomes popular, but most of the time they work by limiting one food group, or they may suggest to increase one type of food group, which may not necessarily be the most healthiest way to lose weight. It may lead to eating disorders, nutritional deficiencies, loss of muscle mass, can cause electrolyte changes, and also affect your bone health. So really, if you are going to enroll in a weight loss program, make sure you consult a professional and do a methodical weight loss. Next slide. So moving on to the World Health Organization's recommendation on preventing dementia and diet, they recommend that a healthy, well-balanced diet is recommended to all adults for a healthy living, for living a well-balanced diet, and that's a strong recommendation. When it comes to preventing cognitive decline and dementia, they recognize that a Mediterranean-like diet may be of benefit to prevent cognitive decline. And the quality of evidence for this is moderate. And again, it's not because it doesn't mean that it's not effective. It just means that we need more studies to really look into this more. As you can imagine, it's not very easy to rigidly have someone undergo a certain type of diet for a long period of time so that we could do a scientific analysis, because diet means there's a lot of variation between people and even in our day-to-day, right? So that's why the quality of evidence it's moderate. They strongly recommend that they do not support using supplements like vitamin B, E, polyunsaturated fatty acids, and multi-complex supplements to reduce the risk of dementia, because there is no scientific data to help support this. And using too much of one thing can actually be harmful in some people. So again, a well-balanced diet is recommended, and not taking too much of one supplement that's not recommended. Next slide. So let's take a look at what a Mediterranean diet is. I'm sure a lot of you are familiar with this, but I just wanted to complete our discussion with the introduction to the Mediterranean diet. So it's a mostly plant-based, includes vegetables, fruits, and if you use grains, they use whole grains, beans and seeds in the diet. And nuts are added, a few nuts are added. And if they use oil, it's mostly extra virgin olive oil. And butter and other refined sugars are not consumed. It's very rare in the Mediterranean diet. And for proteins, it's mostly fish, and the amount of protein they use is much less than a Western diet. Next slide. And then you may be familiar with the DASH diet that we use to help control hypertension and cholesterol, mostly, kind of limiting your salt intake to no more than 2.3 grams per day, or the lower salt DASH diet, limiting salt to even 1.5 grams per day. Next slide. And as you can see in the DASH diet compared to a Mediterranean diet, you have grains and vegetables almost equally, and then they don't specify that oil should be extra virgin olive oil, but they do specify that to limit the amount of fat intake, and then the protein intake, again, in the Mediterranean diet, we saw more fish in the Mediterranean diet, whereas in the DASH diet, we use protein, but the amount is kind of recommended in a DASH diet. Next slide. And then we have the MIND diet. So this was introduced in 2015. And I brought up the DASH diet. The World Health Organization didn't mention anything about the DASH diet, but I brought up the DASH diet in my previous slide because this study actually compared the DASH diet, Mediterranean, and the MIND diet to see which one was best for cognition. So this actually came out in 2015, where a study was done on the aging brain and how diet affected the aging brain. They looked at about 1,000 community dwelling participants who didn't have a diagnosis of dementia, and they followed them up for 9 years with annual questionnaires. And they did 2 cognitive testing to see if there was a decline in their cognition. When they did the study, they found that those who used a MIND diet had a lower rate of cognitive decline compared to the Mediterranean or the DASH diet. Next slide. Oh, the slide before. Yeah, thanks. So what is the MIND diet? So it's really a blend of, you could say, the DASH and the Mediterranean diet, but what it really focuses on is they recommend more vegetables in your diet, just like the Mediterranean diet, but they specifically say it should be green leafy vegetables. As you can see, the portion of green leafy vegetables is way higher than any other type of vegetables. And when it comes to fruits, they specify that it should be more berries than other types of fruits. And they don't necessarily highlight the use of extra virgin olive oil, but they do comment that if you do need to use oil, you can use olive oil. And again, it does include all different types of food groups, but more prominence to the green leafy vegetables and berries. Next slide. The MIND diet also discourages certain types of foods like pastries and sweets, red meat, cheese and fried food, and butter or margarine. The MIND diet is a little bit more specific, and they highlight the importance of green leafy vegetables and berries. In general, I think a Mediterranean MIND diet should be considered if you're thinking about cognitive health. But I wanted to mention a few comments about the use of curcumin, because it has been coming up for a couple of years now. But I think it's been hard to find the right conclusion on the use of curcumin when it comes to cognitive health. Next slide. So curcumin is an active component of the turmeric plant. It's native to the Indian subcontinent and Southeast Asia. In general, traditionally, it's used as a spice or food coloring, fabric dye, or even some for medicinal purposes. Next slide. So curcumin, some of the scientific studies have shown that use of curcumin has helped on mood and behaviors in animal studies, but we have not had very good data on human studies to show its benefit. And for the, thank you. That's fine, Nika. And for the longest time, studies have been limited in human studies because it has been hard to really identify an exact amount of curcumin that can be given to study and do a scientific study where one group gets a certain amount of curcumin and the other group gets a placebo, and to compare those two groups. But then this study in 2016, actually, they developed a capsule that has curcumin, and they gave it to they gave it to one group and the other group got a placebo, and they didn't know which one they were getting. And they followed these participants for about 1 year with cognitive testing. Next slide. So one was done at 6 months, then the other one was done at 12 months, and they used what we call the MoCA, the Montreal Cognitive Assessment, and looked at if there was any benefit in taking curcumin 1,500 milligrams per day. Next slide. So I'm sorry, I should have mentioned that the dotted line here is the curcumin group, and then the solid line is the placebo group. So initially at 6 months, it looked like when they compared the two groups, it looked like there was a benefit in the curcumin group. But when they actually looked at the data, they found that it wasn't that curcumin improved your cognition. There was a decline in the group that didn't take the curcumin. And then, you find yourself asking the question, okay, if it doesn't help improve cognition, does it help prevent a decline? But when they followed these participants for 12 months, they noticed there was no actual decline, that both groups of participants ended up on average at the same level of cognitive function. So the scientist who did this study, next slide, came to the conclusion perhaps we need longer studies to really look into this. But from the study they didn't see any benefit for cognitive function or even for mood. But they did recognize that the group who took the curcumin had some GI discomfort. That was the main side effect they experienced. And then, and that's what we should keep in mind, right? When we are using something that has no clear benefit, and if there are side effects, is it really worth using something? And also keep in mind that curcumin can increase your risk of bleeding, especially if you take blood thinners. So really, in my practice, I discourage use of curcumin for the purpose of, maintaining cognitive health. Next slide. And, other dietary considerations to think about. Next slide. And this was an article that was published in 2010. And it really kind of looked into high fructose intake in our society. Next slide. So sucrose is what we find in fruits. It's usually one fructose molecule and one glucose, but in high fructose corn syrup, we have more fructose than glucose. So this article actually kind of highlights how as a society, how our intake of high fructose corn syrup has increased. And they were trying to highlight that perhaps it can cause more oxidative stress on the body. And then next slide. And then it can also increase your triglyceride levels, and thereby it may increase your risk of vascular dementia, worsen diabetes and obesity. And in that way, it can increase your risk of dementia. So again, it's important to focus on your diet, think about what you're putting into your body, not just for preventing cognitive decline, but for overall health. And yeah, so in summary, lifestyle modifications can make a difference in healthy aging. Consider Mediterranean or a MIND diet, according to the data we have. And, as time goes on, we may have more studies on this. And in general, supplements are not recommended to protect brain health. Thank you.
Thank you so much, Dr. Perera. Thank you for gathering all that data and letting us know what you might use in your clinical setting. So thank you so much. We wanted to open it up for questions if anybody had any on the topics that Dr. Perera presented on.